right, everyone. This is the Healing Oasis podcast, and I have to confess that I don't think I've looked forward to an interview as much as this one. And I'll get into it in a second. You're going to get to know why, but Dr. Isaacs, thank you for joining. And I know that you're busy, so it's very gracious of you. You don't know who I am. You just learned out about the Healing Oasis. So thank you for taking the time to come and do this. So before we begin, maybe I'll let you just tell everyone sort of who you are, your background, that kind of thing.
Sure. Well, as you have already said, my name is Linda Isaacs. I'm a medical doctor. I did my medical school at Vanderbilt University, which is in Nashville, Tennessee. And while I was at Vanderbilt as a medical student, I met another doctor who was doing his internship in internal medicine, but he was also engaged in a research project studying the work of an alternative cancer practitioner named William Donald Kelly. So that was Dr. Nicholas Gonzalez, and he was more than happy to talk about his research to anybody who was interested because he was finding fascinating results in Dr. Kelly's files. So I was interested, and I wound up getting involved in the work with him. Over the years, we conducted research studies, published case reports, and have done a lot to try to keep the work that Dr. Kelly was using alive. And that work involves pancreatic enzymes and diets, but I assume you probably like to ask me about that in bit-sized pieces, so to speak.
Yeah.
Your audience can learn more about me by visiting my website, which is www.drlindai.com.
Awesome. And then you're currently practicing still in Texas, is that correct?
Yes, I'm in Texas. For many years, I was in New York, and that was where Dr. Gonzalez was originally from.
Right.
And so, even though I met him in Tennessee, like a homing pigeon, he went back to New York City. So, I was there for many years. But in 2019, I moved to Texas.
Okay, cool. Awesome. Well, thanks for sharing. So let me tell you why we're even doing this. As I was just saying to you, my wife and I, we bought this 40-acre property in British Columbia. We're trying to help people with cancer. I'm not a doctor. My wife and I love nutrition. We took kinesiology in university. We've always been really into nutrition. Try to avoid the conventional medical system as much as we could, so our kids, never went to a doctor that often at all in their life. So very, very natural focus. So I went to this conference in West Palm Beach, Florida, just last February, and there were all kinds of people there. You actually spoke at it. It was the Annie Appleseed conference, and you spoke at it, I believe, 2 years ago or something like that.
Yeah, last year, I think, and also in maybe 2017,
Right.
along there. Yeah.
So here I am, we're learning about all these alternative therapies. And of course, here at the Healing Oasis, we have a doctor that does the high dose vitamin C, the mistletoe therapy, the hyperthermia machine. So, most of the doctors presenting, they're all talking about all the things that I was aware of. And then up comes a doctor that starts talking about pancreatic enzymes, and this Dr. Beard from the 1900s who had discovered, which I want to get into because I'm going to tell you, I've now read about 5 books about this, but how he discovered the origin, what he thought was the origin of cancer through trophoblast cells. Oh my goodness, I can't tell you. I don't know if I have a whiffer for truth. I've told my wife that when I smell truth, it's like, so here I am in this conference and I'm thinking, I feel like the greatest thing I've ever heard. I couldn't believe it. And no one else seems to really care. And I think part of it was I've been taking systemic enzymes for 15 years straight. My dad introduced them to me 15 years ago. I've never missed a day. I've been telling my friends and my family about systemic enzymes on an empty stomach and how it's ate away my inflation, my injuries. I mean, I am the biggest believer in enzymes. So I think part of it was I couldn't believe that there was this theory about cancer that involved enzymes when I already was the biggest believer of it. So I
Mhm.
start reading all these books. I mean, I'm buying Dr. Gonzalez's books that he has. I'm reading about Dr. Beard. I found his book online, one of the books he wrote, and I'm reading about Dr. Kelly. And I cannot believe that this is not the most talked about thing in all of cancer. It is beyond understanding that I don't know if it's just me. Maybe Dr. Gonzalez and you felt the same way, but I just can't believe more people don't know about this.
Well, thank you for doing your part to help more people know about it. That's what I would say. Yes, I believe that it is something that's extremely useful and that it has been overlooked. And so I'm continuing to do what I can to help change that. I know one of the things I did was write an article that was published in one of the medical journals a couple of years ago, just detailing the history of the use of pancreatic enzymes. Funnily enough, there is a company now that's trying to get intravenous enzymes tested. So that's a relatively new thing, but I personally hope they get somewhere with that because I think it would be very useful for people that cannot swallow a lot of pills. And that's what's involved with the treatment that I offer, swallowing large amounts of oral pancreatic enzymes.
Right. So let's dive into this a little bit, and I hope you don't mind getting into the science because I love talking about the science about stuff like this. So is it true? Okay, so one thing I keep asking the cancer guests that come to my place, no one's. It's amazing we're in 2024, and it strikes me as odd that I've never been told a theory that makes sense to me. So in all of the books I'm reading about cancer, everybody says it's undifferentiated cells that replicate without constraint that invade other tissue. And it's like, okay, you're describing what it is. I understand that. But what oncologist says, well, here's the theory of the origin of cancer. I find that everybody that comes to this place, everybody I talk to with cancer, they don't really understand the origin of it. And if you don't understand the origin of it, how on earth could you possibly find a solution to it?
Mhm.
Do you agree with that? Like, is there do you I mean, the origin of cancer and what Dr. Beard wrote in 1905 and then 1911, I believe the book that I was reading was called the enzyme treatment of cancer and the scientific basis, something like that.
Right.
It was absolutely fascinating that this was written in the early 1900s, and he's describing what he considers to be the origin of cancer. I'm going to ask you, Dr. Isaacs, now that you've done this for 30 some years, do you think that theory or that idea still holds true to this day?
Well, I think that Beard's opinions and theories make sense, and what he observed was that cancer looks and acts, looks under the microscope and acts rather like some of the cells of the early stage of the embryo. The trophoblast is the technical word. It's the precursor of the placenta. And what he observed was that the trophoblast cells, their job is to latch on to the inside of the uterus to provide an anchor for the baby. So those cells invade into the mother's uterus, and they also create a blood supply. Well, cancer does the same thing. It invades and it creates a blood supply. What Beard observed, though, was that at a certain point in development, the trophoblast stops invading and matures, becomes a placenta, and then at delivery, it neatly peels off and leaves the uterus intact. So the big difference between the trophoblast and cancer is that the trophoblast stops, but cancer just keeps going.
Right.
So Beard speculated that if he could figure out what the signal was that got trophoblast cells to mature and change, then maybe that would be a solution for cancer.
Right. Oh, hold on.
I should say, was that at the time that the trophoblast cells stopped invading, the baby started making pancreatic enzymes. And this would be 7 months before that baby's going to see a meal. Pancreatic enzymes are theorized or believed in regular medicine to only have a role in digesting food. But here, this baby's making enzymes months before delivery. But if the role of the enzymes is to control the behavior of the trophoblast, well, then it makes all kinds of sense that they're created that early. And so Beard went from that, he made the jump to say that in all of us, pancreatic enzymes have two roles. Yes, to digest food, but also to control the behavior of any cells that might be heading from, being a precursor, a stem cell, as we would call it now, towards becoming a cancer cell, that pancreatic enzymes can nudge it back into proper behavior, so to speak.
Okay,
So that was Beard's theory.
okay, so this is fascinating. So maybe we'll just touch on Beard's theory. So, first of all, for context, so everybody listening, this isn't just some random guy. From what I understood reading his book, he is one of the leading scientists of the time for studying embryos. In fact, some of his stuff that he discovered and wrote about is still used to this day. That's how intelligent of a scientist he was. And second of all, his theory wasn't just a theory. Apparently, the whole entire medical community at one time was very interested. Now, what happened was a lot of what he was talking about pancreatic enzymes, there's a lot of doctors that weren't injecting the right doses, the right combinations, the right. So then people were getting various results, and people were saying, oh, his theory isn't right. But he wrote a book that said, no, it is absolutely true. He documents it. It is fascinating that this was over 100 years ago. And what he called trophoblast cells, is it correct, Dr. Isaacs, that that is now what people refer to as stem cells?
Yes, that's what I think. He claimed to be able to see what he called wayward trophoblast cells really throughout the body in mature tissue. And at the time, people thought he was a little crazy, but what he speculated was that those cells were there to be as a reservoir for repair and for replacement of cells. But that's exactly what stem cells do. They're present throughout the body, and they're there to as a functional reserve. For instance, our skin or our intestinal tract, all of those cells replace themselves very rapidly. Within a few days, we have a whole new set of skin cells. Those have to come from someplace. And the idea being that it's stem cells. It turns out that on a molecular level, there are a lot of similarities of trophoblast and stem cells, a lot of the receptors on their surface, a lot of the ways that they behave. So I believe that Beard, in effect, was talking about stem cells.
Okay, and then so just so everybody knows, because they haven't read the book, of course, I tell people go on Google and try to find it if you can. It's hard to find, but if you can, try to find it. He did inject people and proved his theory to be correct, just so that everybody's listening. They'll be astonished to find out that he actually was injecting people with pancreatic enzymes, and it was liquefying the tumors. And at the time, he has documented case studies that he talks about, where this was happening. And at the time, I believe he was saying that in the medical profession, they had never seen anything like this.
Well, it was, they didn't really have much of an effective treatment for anything in that era. I will mention, though, Beard, strictly speaking, Beard was not the person injecting people because he
Right,
wasn't a physician. He was a PhD, he was a scientist.
right,
So he, not being a medical doctor, he couldn't do that, which was in a way a shame, because what that meant was that there were a lot of doctors out there that were not necessarily using good quality product. And so there was a lot of argument about whether or not the enzymes actually worked. And part of the reason why his work eventually kind of disappeared into the shadows, so to speak, was that at around the same time, X-rays or radiation became popular. And it was billed as a treatment not only for cancer, but for acne. I mean, I've actually met people who saw a dermatologist back in the 30s and 40s and got radiation for acne, believe it or
right.
not. And they can wind up with some pretty nasty cancers many years down the road. So radiation was thought to be, in effect, a magic bullet, whereas Beard's product, it had to be injected. Apparently, it was painful. And then there's all this argument: does it work? Does it not work? And they said, oh, let's just do radiation. That's so much easier. And so Beard's work it went out of style, I guess you could say. It was
Right.
never truly tested in a proper fashion. It just went out of style.
So, for everyone that's listening, because I want them to know where this is going, I need everybody to realize that I have never seen something so fascinating. I have read about cancer and the different alternative therapies. I have never seen a history of something that is so, to me, it rings true. So I want everybody to stay with us because there's a reason I want everyone to watch this. There's all kinds of things like Dr. Gonzalez used to say, like you can get alternative therapies. There's thousands of people that claim like this will work, and people are all confused. And I just want people to realize there is real science behind this theory that started with Dr. Beard, and there's a over 100-year history. So the next step I want to go into. So Dr. Beard discovers trophoblast cells in the early 1900s. He then discovers the link to cancer because they operate exactly like cancer cells. So he realizes, wait a second, it's the pancreas and the pancreatic enzymes that are somehow stopping the trophoblast from continuing to replicate without constraint like cancer does. So he makes that connection. So then this sort of goes, it sort of loses, people didn't pick up on it like x-rays, like you said, and then it sort of goes out. And then here comes this Dr. Kelly. I believe he was an orthodontist. Is that correct? Yeah.
Yes, Dr. Kelly was an orthodontist by training, and I just want to mention there were a few other doctors who used enzymes against cancer in the interim, but Dr. Kelly was an orthodontist who had an academic interest in nutrition, by which I mean that he read a lot, but he didn't do it. He was eating a lot of junk food, and what happened was when he was in his late 30s. This is the early 1960s. He started to lose a massive amount of weight and could feel a mass in his abdomen. And he went to the doctors and was told, you most likely have pancreatic cancer and get your affairs in order. What he did instead was modify his diet, which stabilized him a bit. But then the story has it that he started using pancreatic enzymes just because his digestion was terrible. He wanted to improve his digestion. But what he found as he started to take large amounts of pancreatic enzymes is that the character of the mass in his abdomen started to change. So, based on that, he wound up, in effect, creating a way of dealing with cancer, dealing with his own situation. And then, once he'd recovered, his community recognized, this guy that looked like death warmed over is back to his usual self. And so, people started coming to him not because of their crooked teeth, but because they had a cancer and they wanted his help. So bit by bit, he migrated from orthodontics to alternative cancer practitioner.
Okay. And then um did you get to meet Dr. Kelly?
Mhm. Yeah, I met Dr. Kelly in 1984. So yes, I did meet him. Uh-huh.
Okay. And then what from my understanding, and I read his book, The One Answer to Cancer. I found that one too, by the way. So I encourage people if they can find it. You got to go searching for it, but The One Answer to Cancer. Now, I want to get into a little bit of the things he says in his book, but he treated like or treated or helped people. I don't know what the word is, since I think he was not technically a medical doctor, but he was helping people by giving them knowledge about pancreatic enzymes, high doses, and nutrition. But there were thousands of people, thousands with stage 4 pancreatic cancer, breast cancer that metastasize. I mean, there's thousands, and I would love you to tell me, Dr. Gonzalez, when he was a young medical doctor in his internship, he was studying. I think he was under Dr. Good, and didn't he went and spent like 4 years investigating all of those cancer cases. Is that correct?
Yeah, that's correct. Dr. Kelly and Dr. Gonzalez met in, let's see, I believe it would work out to be 1980 or 1981. And Nick finished up his research project in 1986. He went through around 1,400 charts, as I recall, and they then sent out postcards and tried to get people to be willing to be interviewed. He went through quite a lot of records and wound up putting together a monograph with 50 patients with different types of cancer. And that book is called One Man Alone, and it is available. Yeah, and Nick did all of this while he was completing medical school, doing his medical internship, and then doing an immunology fellowship under Dr. Good. So he worked incredibly hard on all of that, getting all that material together.
So can I just point out something that I don't think is obvious to people? When someone hears about alternative treatment that helps with cancer, it's very rare that there are hundreds, if not thousands, of documented cases where this alternative therapy has actually been proven through these case studies to reverse cancer, to heal cancer. You might hear of one or two cases. There's a hearsay, a story, she said, he said. It's like, but this is very unusual, is it not? And I want to ask you that. Is this not unusual in the alternative natural treatments to find such documented cases of stage 4 terminal cancer where people were healed? Oh, did I cut out? Oh,
Yeah.
did I cut out there?
Yeah, you did. You froze up there. You were about to finish your question, I believe. So, uh, what I would say is honestly, I only know my own work in the sense that I haven't been going around to all the other practitioners doing different things to say, do you have these kind of case reports? Dr. Gonzalez and I have always tried to approach this with an effort to demonstrate its efficacy. And so, we've worked to create case reports as we've gone along. In fact, I published some in 2019, even a few years after Dr. Gonzalez passed away. So you're in a better position to answer that one than I am in a lot of ways. I do what I do. And honestly, the reason I do this, it's not so much because I find Dr. Beard's theories compelling, because theory is cheap. You
Right,
can make up a reason for whatever you want to think.
right,
And that happens in Orthodox medicine too. There's some great examples of theories that didn't pan out.
right.
But what got me involved in this is the case reports of Dr. Kelly's patients. We have people with metastatic breast cancer that, like a woman that I talk about a fair amount in my lecture. She was diagnosed in 1970. She had actually had breast cancer on both sides, and she was a young woman at that time. She was in her late 30s. And then a couple of years later, she started having terrible back pain, and they did an X-ray and established that her shoulder blade looked like it had been eaten by moths. It looked like cancer had spread there. She was doing great at the time Nick finished up his research project 10 years later. But I spoke to her in 2016. Now, this is like 40 years after the diagnosis of metastatic breast cancer. And she was alive and feeling fine and had no further issues with cancer. She actually died, I found online in 2019 or 2020, something like that. She was in
Wow.
her late 80s at that point.
Wow.
So she outlived a really nasty prognosis by 40 years. And this kind of thing is what keeps me going with the patients I have myself that have outlived horrible prognoses, Dr. Gonzalez's and Dr. Kelly's. That's why I do what I do.
Wow. So, and just to say, I am not trying to discourage, I mean, obviously, even at the Healing Oasis, we do IVs. We have an amazing naturopathic doctor. We have the hyperthermia machine, local regional hyperthermia. I am not trying to discourage honest, sincere doctors that are doing good. I'm just trying to point out that in all of my research, I have never seen the case studies and the evidence and the results of a treatment like what you and Dr. Gonzalez have done and what you're continuing to do, which is, the three-prong approach: personalized diet, high dose supplements, enzymes, and detoxification. It's just astounding to me, the results that you're getting. So I want to jump into that a little bit. So Dr. Gonzalez starts after he learns about Dr. Kelly, spends 4 years. You and him sort of start a clinic in New York together. Is that correct? Like, you practiced with Dr. Gonzalez for quite a time.
Yeah, that's correct. He started seeing patients in 1987, and we were, subletting from another doctor and didn't have a whole lot of space. I wound up finishing up my medical training, my regular internal medicine training, and then came back and was working with him starting in 93 was when I started seeing patients as well. And so we continued to work together up until he passed away in 2015. And I've continued the work since.
Okay. So now you have a lot of experience with pancreatic enzymes. Obviously, we could do a whole session on personalized diet. We could do a whole session on detoxification. But today, I want to specifically focus on pancreatic enzymes, and just because of how big of a believer I am in systemic enzymes. So what I want to ask you now more detailed questions about this. So, in your experience, I have been told multiple times by many different doctors in different conferences that there's no way you can shrink a tumor naturally. No way. You have to use chemo, or you have to use repurposed drugs, or you have to use, a machine like a hyperthermia. Can you attest to this now that you have helped, I don't know, hundreds of people with stage 4 cancer? Does pancreatic enzymes, I think Dr. Gonzalez has said this, and I want to ask you directly, do they actually have the ability to directly start liquefying tumors?
Well, I certainly have patients where their tumors have gone away. So one presumes that yes, that happened. I will say, though, that in the short run, sometimes things look worse before they look better. And we believe that that's because of an inflammatory reaction that happens. Bear in mind, the body is already trying to fight cancer. Chemotherapy, if you ask me, probably some of how it shrinks the cancer, so to speak, is by getting rid of the inflammatory reaction that the body's already got to that cancer.
Right.
In what I do, the enzymes are attacking, it creates dead cells. Those dead cells are much more irritating to the body than the live ones. A lot of white cells and things come to the area to try to break it up and get it out. The net result is that in the short run, things can actually grow before they shrink.
So when you
So
when you say short run, so somebody has cancer and they start doing some high dose pancreatic enzymes, are we talking about weeks? Like, is that when you say short, do they might see it almost like it gets worse within the first few weeks?
yeah, it can get worse within the first few weeks. And what we see many times is that the first 3 to 6 months is when you see the inflammation and irritation. Now, part of it also depends on whether people are adherent with their diet and their
Right.
detox. It's and that's part of why the treatment is a package. It's
Yeah.
not just the enzymes, because it all works together. So if somebody is taking a lot of enzymes but they're still eating a lot of junky food that's going to require energy to detox that,
Yeah.
well, then that whole business of inflammation is going to be 10 times worse.
Right. Okay. So, and I agree with that 100%. And that's why I said we could go into a lot about the diet. And I just want to clarify, because I think what you're trying to say is, yes, we're focusing on the enzymes, but really the therapy that Dr. Gonzalez and you do is very specific to personalized diet, plus the supplements and high dose enzymes and the coffee enemas and other detoxes that you do. So I want people to dig into that, because there's all kinds of stuff they can find online about that. but the enzymes are what fascinate me the most. So Dr. Kelly says in his book, One Answer to Cancer, he says that cancer is nothing more than than a deficiency of pancreatic enzymes in the body. Do you agree with that statement, that that's what cancer really is? Or do you think Dr. Kelly was pushing that a little bit? Or do you actually think that's what cancer is? And again, this is your opinion. I'm not saying that as a doctor, that I would like to hear your opinion on that.
Yeah. Well, look, I think that it is true quite a lot of the time. I also think that the diagnosis of cancer really is an umbrella term for a lot of different illnesses. And, so whether I would make that sweeping a statement, I don't know. But I think that pancreatic enzymes are one of the main defenses of the body against cancer. And so if people don't have enough enzymes, they're going to have a problem. The next question, of course, would be why don't people have enough enzymes?
Exactly.
And that could be anything from a genetic predisposition, that's just kind of the way they're wired. Another possibility is eating the wrong diet for their particular metabolism. So if somebody who doesn't make a lot of enzymes by nature eats a lot of food that requires it, then the first use is always going to be for digestion. Because if you think about what does the body use enzymes for and where would the priorities be? Obviously fighting cancer doesn't really matter if you starve to death in the
Exactly.
meantime. You got to digest your food. So if you eat a lot of food where the enzymes have been cooked to death, or if you eat a lot of food that requires a lot of enzymes, and you're just not somebody that makes a lot of enzymes, then you can wind up in trouble.
Can I just say how excited I know you can sense the excitement. You have no idea how this theory of enzymes and this Beard and Kelly, how much it just makes everything make sense about the cancer and why people get results. So for example, a lot of people get results eating a raw plant-based diet on with cancer. Well, guess what? If you believe in the theory of pancreatic enzymes and its role, it all makes sense because first of all, plants are full of enzymes, especially if you're getting it right out of the garden, if that's the way you can get them. I mean, once they're shipped in a truck and ripened, they lose enzymes. But if you can get it right out of the earth, you're getting a ton of enzymes. When you're drinking the juice, you're getting tons of enzymes. But then people are always against red meat and just animal meat. And personally, I just have to say that I have seen a lot of healthy people in my life that have ate meat. My grandpa was one of the healthiest guys I've ever met. He was ahead of his time. He would eat mushrooms from the field. He had his own garden. He loved meat. He ate meat a lot. He lived till he was like 93. He was just so healthy. So this idea that animal products is bad, and I'm not trying to, people who are listening this, they have very strong opinions about this, so don't get me wrong. I support whatever people do. The reason I'm asking this is because it makes sense. If you're eating red meat and you already have a deficiency in enzymes, it's not that red meat is necessarily bad, it's that you're using up your enzymes to digest all this red meat, which could be used to help fight cancer.
Yeah, that's right. And it really depends on the person. One of the things that Dr. Kelly theorized that makes sense to me is that people who do well on red meat are actually people who have a strong digestive system and who make a lot
Yes.
of enzymes by
Yes.
nature. I'll also mention that especially in the modern world where we're exposed to all kinds of chemicals and stuff, that it's possible that a cancer patient is someone who would have enough enzymes if it was 200 years ago, but in the modern world, their body is making more cancer cells than they can get rid of.
Yeah.
And so that's where another way that detoxification ties in,
Right.
is to get rid of some of the toxins so that you're not creating so many cancer cells, so that the enzymes can then take care of what is being created.
So a question that just comes to mind, and I want to ask this: now that you know what you have seen, some very poor prognosis cases, stage 4 cancer, you've helped them. You've seen people that are supposed to be dead. They're alive. They're doing well. Are you scared of cancer now that you know what cancer is and you know how to treat it with personalized diet, pancreatic enzyme supplements, detox? Are you personally scared of cancer?
Not really, no. I guess many doctors are good at believing that none of these things will happen to them,
Right.
but I take extra enzymes just as a preventive. So no, I'm not particularly concerned about it.
Okay. Now, talking about the because I we're gonna keep going on the enzyme. So I ordered the, and I know you might have it, I read Dr. Gonzalez's books and he always was saying this company Allergy Group, so I'm sure you're aware of it. I have a tub of them here so that people can sort of see what we're talking about. So I want to talk about the high doses. So I know that as a doctor, you can't prescribe like a general rule. You can't say, oh, you should do this because everybody's different. But when you say high doses, are we talking about like 60 to 100 of these a day spread throughout the day?
Yeah, it's in that general territory.
Right.
Yeah.
So what do you tell people that are like, okay, how am I supposed to take 60 to 100 a day? I know that it's spread throughout the day, so they might do it 6 times a day on an empty stomach plus with food. But if people think that's a lot, is that sort of what do you say to someone who thinks that's a lot?
That's what it is. I mean, first, I don't necessarily have those conversations with people because I make it very plain up front on my website that this is what it is.
Right.
So if somebody doesn't want to do that, they're not too likely to come and talk to me. But what I would say, if I was getting into that conversation is, over the years, Dr. Gonzalez and I had plenty of patients that decided that they didn't have to take all those pills, and those are not the people that got well.
Yeah.
So, the same thing goes for the diet. The same thing goes for the detoxification. We've had people that decided that this was not important and they didn't have to do it. And those people are no longer with us.
Right.
So, I didn't create the biology.
Yes.
Um, and part of the reason why, I'm rather enthused about this company that's in the very, very early stages of doing an intravenous product is because that would eliminate that variable. I clean up their diet and do detox. But sometimes people they're looking for a treatment that is done to them as opposed to a treatment that they
Exactly.
do.
Exactly.
And this treatment is very definitely something that you do for yourself.
Yeah.
And that means that you have to be convinced that you want to live every day, um,
Yeah.
going forward. It's
Totally.
not something that you show up and stick your arm out. And there are some people that they're so sick that they need a treatment that's done to them. Don't get me wrong. I'm not trying to be critical. It's more just to recognize where you're at and what you're looking for, because this is not easier than orthodox treatment. It's a lot of work.
Okay.
Um,
So
reality.
are people allowed to open up the capsules and put it, like, let's say they had to take and they're like, I don't like swallowing that many pills. Can they open it up and put it in like juice or something?
Well, they can open it up and put it into water preferentially, because anything that's got calories in it, you're going to lose a little bit of the enzyme
Right.
activity just because of it digesting what you put it into. I can tell you though that not too many people stick with that because the product, it doesn't dissolve, so it's
Yeah.
like little flakes of meat that are floating around,
Right.
sticking to glass, and it's not fun.
Yeah.
So some people do it that way, but most do not.
Right. Yeah. I mean, I'm okay. I've personally been taking enzymes. I've never missed a day. I'm actually being honest. I think for 15 years, I don't know if I've missed a day of taking them. I've been telling my friends and family for 15 years. I take like when I get an injury, I take like 30 in a day, and I'm fine with it. And but when you know something works, oh, did you cut out? Oh, hold on here. We're just gonna make
Yeah, froze up again.
Okay. I was just saying, when I get a sport injury, I would take up to 30 enzymes a day. And, no doctor told me to. I just started to realize, oh my goodness, these heal my body. And I just took like 30 in a day. And that's not even with cancer. I guess what I'm saying is if you truly believe in something, you don't need someone to tell, oh, you got to take this. I believed in enzymes. I saw what it did in my body. So I took 30 in a day. No one had to tell me to do it. So I'm just a huge believer. Now, when people take high doses of enzymes, I got all these questions for you since you're the one that knows all of this stuff. I've been taking enzymes for 15 years, but it's only on my body. I've never seen it with other people or people with cancer. What is there any kind of cancer that they shouldn't do this on? Like is this good for stomach cancer, colon cancer? Is there any kind of cancer that they shouldn't be taking high dose enzymes with?
Um, well, that's in a way, a tough one to answer because I believe that potentially this could help with any type of cancer. But what I'd also say is that historically there have been some types that haven't done as well, and so I'm reluctant to try to treat them. Specifically brain cancers like glioblastoma, for example, and also anything that is plugging up the biliary tract, because that's pretty difficult to work with. The issue with the glioblastoma, though, I believe comes back around to that whole business of cancers that are attacked by the enzymes so they can swell before it shrinks. And the Orthodox medical world has started to recognize this phenomenon because of immunotherapy.
Right.
What they're talking about is a situation called pseudo progression. So what that means, pseudo is fake, so pseudo progression means it looks like progression, but it's not. And they're describing it as exactly the same mechanism that Dr. Gonzalez and I have been talking about for years, which is when the cancer is attacked by enzymes, an inflammatory reaction occurs. But when the immune system is jazzed up to a ridiculous degree by immunotherapy, tumors can swell. And they're talking about seeing that quite a bit, but especially in glioblastoma. What I've found is that when I've tried to treat glioblastoma, the patients get that pseudoprogression and they're terrified, and I
Right.
don't blame them. And so they don't stick with it. So I have just wound up feeling like that's not a diagnosis I want to work with.
What about a
Uh,
glioblastoma where they have surgery and they remove it? Then is that easier to deal with?
If somebody were to come in to see me immediately after they had the surgery, then very possibly. And actually, Dr. Gonzalez had a patient with glioblastoma who made it to 3 years, and she actually died because they left these radioactive pellets in her brain, and that delayed reaction and damage and even death from radiation. So she lasted 3 years, which is remarkable for glioblastoma. The trouble is that it's a rare thing, honestly, that people come in to see me right after their surgery. Because even though they hear, the likelihood that this cured you is pretty close to zero, they still want to believe that they're good.
Right.
And so the vast majority of the time, we would hear from a patient like that when the cancer was back and they were in pretty bad shape.
Right. You tend to always hear that's probably a common thing. People turn to alternative or natural methods after they've lost hope in the conventional system, and so you have to deal with that a lot. So let me rephrase the question a different way. Are there cancers that you find respond very well to and again, I got to clarify, you do a personalized diet, you do high dose pancreatic enzymes and detox, but in specifically, are there any cancers that respond very well to high doses pancreatic enzymes?
We've seen a wide variety of different cancers respond. So really, for me, it's more about the person with the cancer than it's about the cancer. uh, and that could be whether they have a lot of other medical issues or, even just their attitude about the whole thing.
Right.
and whether they're willing to put in the energy. Because we've seen a lot of different types of cancers do well. So to say that there's one particular one that I get, I'm like, yeah, we can. This is going to be a great one. It's more about the type of patient.
Right.
Like for instance, I find engineers and accountants are usually pretty good patients. If they decide to come in because their attitude is, give me the tools, I'll pick them up and use them. And why would I come to see you if I wasn't going to do it?
Right.
They're very logical, and
Yeah.
that usually pans out well.
Okay. So this, as far as side effects, you've talked about that. Obviously, when a tumor starts to get attacked, when enzymes start to eat away at it, there can be inflammation. So obviously, people can get pretty scared if they start sensing that in their body. That's something that can alarm them. I know in Dr. Kelly's book, One Answer to Cancer, he said that if you start to find like you get super ill, he said be excited and because the enzymes are working because you've all of a sudden feel really ill. He actually said maybe cycle off for maybe 5 days if you feel really ill. Is that something also that you would advise?
Yeah, cycling off the supplements periodically is part of the program. It's something that Dr. Kelly had patients do. It's something that we have patients do, and it's to help them deal with the waste materials that can build up, and also, help them recognize that yes, the symptoms are due to waste materials. Because once people recognize that pattern, it can actually be a form of reassurance.
Right. Right. So in a general rule, if you start to feel awful, you can take a 5 day break or something just to let your body recover and keep doing the detox methods, which by the way, I have to point out, coffee enemas. I know that you guys, Dr. Gonzalez often said twice a day. But I just want to say to people listening that even if you took high dose pancreatic enzymes, change your diet, if you don't do detox, then all this dead tissue is not getting cleared out of your body. And that's super important for the detox side of it. What about bloating? Like if you do a quick Google search, of course, I do Google searches all the time, pancreatic enzymes, the first thing that comes up is constipation and bloating. So talk about that. Is that an issue that you have seen?
Not particularly, no, but of course we're having people do coffee enemas, so perhaps that takes care of quite a bit of it. I'll also say that there are different kinds of pancreatic enzymes.
Right.
So the ones that we use are, in essence, freeze-dried pancreas. They're a fairly simple product. It does go through a little bit of an activation process, but your typical enzymes that you might get, either the pharmaceutical kind or many of the health food store kind, are what's called pancreatin. And pancreatin is a chemically processed product it tries to concentrate the enzymes. But it does have some chemicals that are used, and so those chemicals can be irritating. And then many times it has an enteric coating, the idea being that they need to be protected from the stomach acid. But what we believe is that the enzymes are perfectly capable of making it through the stomach intact when we're using whole freeze-dried pancreas. So their issues with bloating or whatever may be because of the chemicals in the pancreatin or the enteric coating, as opposed to the pancreatic enzymes themselves.
Okay, so you don't experience a lot with your patients, a lot of constipation or bloating, and that might be because they're doing coffee enemas.
That's correct. I mean, I suppose sometimes they get bloating, but it's not like I'm getting calls about that on a daily basis, far from it.
Right, right. Now, for anybody that doesn't, because I know a lot about enzymes, so I'm very comfortable talking about enzymes. Like I told you, people that are just hearing about this for the first time, can you explain what an enzyme, like people might be like hearing about us enzymes, and I'm a huge believer. They don't know what it's like. Like I have a history with it, so I believe in it. But I mean, I just want to say that an enzyme, just so people are listening, they're like, what is this? It's a catalyst to every reaction. You cannot live without enzymes. So maybe reassure people that this isn't some like I don't know, drug that people are like, what is this? It's a pretty natural occurring thing. So maybe just talk about that.
Yeah, well, you just summed up enzymes just a moment ago. They catalyze reactions. So what does that mean? It means that an enzyme brings about a specific reaction that would never happen if the enzyme wasn't there. So the enzyme latches onto or fits into a substrate, as it's called, and then the it almost comes across like a miraculous event, that something happens, that the enzyme changes the shape of the substrate and turns it into something different.
Right.
Our bodies are filled with enzymes that do a lot of different things. What we're talking about specifically here, pancreatic enzymes, are enzymes that have been known to have a digestive function for really 150 years. People had figured out names for the different enzymes even before they knew what the protein structure was that even did the job. But they knew that some enzymes break up proteins, some enzymes break up fats, some enzymes break up starches, and they all have different names. So the enzymes that we're having people swallow are very, very similar, if not identical, to the enzymes that their own pancreas makes. They're not alien substances at all. And in fact, the pancreas tissue, people used to eat the pancreas all the
Yes.
time.
Yeah.
In fact, the pancreas and the thymus, those two glands in animals were called sweetbreads
Yeah.
because they were so tasty. So if you went back, 150, 200 years ago, people were eating those all the
I,
time.
I
Um,
actually, it's funny you say that because I had a theory. I was talking to my wife. I said, cancer, I wonder how often there were cancer back 200 years ago when people were eating the pancreas. I wonder how often. Oh man, did I lose you again? Oh, Dr. Isaacs, you there? Oh, you came back.
yeah,
I was just saying that's my I'm in the boonies. The healing oasis is right in nature. So I was just saying I had this theory with my wife, and I often have these theories as I read about stuff like this, that 200 years ago when we were eating the pancreas a lot more common. I don't know, but it would be interesting to see the cancer rates compared to 200 years ago, and then when people stopped eating pancreas and other organs. And Dr. Kelly talks about this, that we stopped eating organs, and there's so much nutrients and enzymes that we're missing out on. So let's talk about people that don't even have cancer, like me or you or other people. Can you talk? Is it not true? Because I've used enzymes for inflammation. I mean, I have seen it firsthand eat away inflammation in my own body, and it is a miracle. Can you talk about that as far as, do you believe enzymes help people even that don't have cancer, that it's helping with inflammation in their body?
Yeah, when I was researching the big article about pancreatic enzymes that I made reference to, and it's freely available on, like if you go to PubMed, the big National Library of Medicine website, and Google and put in my name, you will come up with that article. But when I was researching that, I found an article that was written a couple of years ago. It's 80 pages long, and it talks about all the different things that proteolytic enzymes do in the body. So they didn't really talk about cancer all that much, but they talked a lot about uh, inflammation. They talked a lot about, well, it was pretty sweeping, the number of things that proteolytic enzymes do in the body. And there's been a fair amount in the literature. I guess when I think about enzymes and inflammation, I tend to think more about some of the plant-based enzymes like bromelain,
Right.
or papain. But yeah, pancreatic enzymes can work in that way as well.
Right.
Sure.
Okay, so we've talked a lot about enzymes. I am so fascinated, and I'm so excited. We're coming up on the hour, so I just want to make sure I ask the most important questions to you because I've been dying to talk to you. Is it, by the way, I hope this is okay to ask because it's in Dr. Gonzalez's book, so I'm pretty sure it's public knowledge, but were you actually married to him at one time?
Yes, he and I were married from 1985 to 1993 or thereabouts.
Okay.
And yeah, it was from my point of view anyway, I was just too much like being in a pressure cooker. He wanted to talk about enzymes all day and all night, and
Sounds like
he
me.
yeah, and he only needed 5 hours of sleep, whereas I am an
My,
8 hour person. And the net result was that while it was, I think, a good working relationship, it wasn't a good marriage relationship. But we both wound up happily remarried to other
right.
people.
My
Um,
wife
that worked out.
my wife always tells me that I got to stop waking her up in the night, so I should probably take her advice since I'm hearing you.
Yeah,
My
don't wake her don't wake her up to talk about enzymes. It's not
okay.
not good.
I mean, I am so passionate about enzymes. I don't know how I started the Healing Oasis. I don't know. God has a plan in our lives that is astounding. I mean, here I am so passionate about enzymes, believe so much in enzymes, and then I start this Healing Oasis, and then I come across this, and now I am like the biggest promoter of this, and I want people to really dig into what you're doing, what Gonzalez did. So can people take enzymes if they're doing chemo or radiation? Like, is there any reason people shouldn't take enzymes at any time, or is it okay to take enzymes at any time?
Well, I certainly think that taking a few with meals is always reasonable to do. Whether they would want to combine an aggressive enzyme program with chemotherapy is beyond my experience because I don't
Right.
typically treat people that are choosing to do that.
Right.
Um, so I don't know what to say on that one.
Okay. Okay. So you don't have a lot of experience with that. Okay. What about supplements? So let's just quickly touch on the fact that you don't just do high dose enzymes. You also do supplements. Now, you and Dr. Gonzalez obviously don't believe that every vitamin and mineral is good for everybody. And anybody who wants to dig into this, there's a book that Dr. Gonzalez read about nutrition and the autonomic nervous system. The theory is, and again, I'm not going to go too deep into this, but the autonomic nervous system is really the basis of your health. Some people are more parasympathetic, some people are more sympathetic, and people should understand their metabolic type because different minerals and vitamins can affect. And if you're parasympathetic, you don't want to take things that make you more parasympathetic. And if you're sympathetic, you don't want to take things that are more sympathetic. Did I do a good job summarize that really quickly?
Yeah, you did. And I'll also, just throw in there that if people want to visit my website and sign up for my newsletters, what they'll get is an introductory series that will give them bite-sized pieces for all of this. There's quite a bit of information on my website about all of this as well.
Okay.
But yes, that's the general idea that different people need different things.
Okay.
That's a big part of the underpinnings of what we do and what Dr. Kelly did before us.
So let's not talk about people with cancer right now. Let's just talk about that. There's hundreds of people like me. I can't come see you in Texas. I would love to, but let's say I can't come. There's people that are listening to this and they're not necessarily got cancer, but they're like, I totally believe in the autonomic nervous system. I totally believe in the science of what you're saying. How do I know what vitamins to take? Like, what do I do if I'm just a healthy guy going, okay, I want to make sure I keep in balance? How do I know that?
Sure. Uh, all right. Well, I guess first of all, I would like to emphasize again that there is information out there because this is like a huge topic. And
Right.
if you want to have me come back and talk about it, I will.
Okay.
But the short version, so to speak, would be that the people with an extremely active sympathetic nervous system, they're the ones, their fight or flight reaction is very overactive. And if you think about an animal in the animal kingdom, you've got deer or rabbits, they're very twitchy, they're constantly looking around, and they're vegetarians,
Right.
right? So people with that overactive sympathetic system are usually the people that they feel better if they eat salads. They don't feel better if they eat meat. They eat meat, they feel like they ate a brick.
Right.
The people on the other extreme with the overactive parasympathetic system, they're the rest and digest people, and they can be like the carnivorous animals. If you think about a lion, well, you might think about a big ferocious animal, but in fact, when they're not hungry, they're pretty chill. They sleep apparently like 15 or 20 hours a day. and they eat nothing but meat. The parasympathetics, the people way over on the extreme, they only feel good if they eat a lot of meat. They
Right.
eat a salad, they're starving 45 minutes later. They're like, I didn't eat anything.
Yeah.
Where's the meat? But then there's a lot of people that are in the middle, and in the middle is where we function the best. You know, the vegetarian people, the sympathetics, that vegetarian diet pushes them towards balance. The extreme carnivores, that meat diet pushes them towards balance. But the people that are already balanced, as long as they don't go on a fad diet, you know, like one of the extremes, they'll be fine. You know, and so it comes down to listening to your body. You know,
Yes.
everybody likes sugar and nobody should eat it, but once you get away from plain old sugar, you will tend to be attracted to
Yep.
what's good for you.
Totally.
And so you listen to your body and eat that way, and that will usually work.
Okay, and we won't get too deep into supplements, but is there anything that everybody can take? So I'm going to give you an example. Omega fish oils, like I tell my kids to take it because there's a deficiency in our culture. Like, is there certain things people should take, like the omega-3 type thing, or that you recommend that people should just take?
Yeah, look, I think fish oil in general is fine for pretty much everybody, partly because I think fish, you know, most fish is fine for everybody as well. I will say, though, the extreme vegetarian type people can do better with the plant-based omegas like chia
Right.
seed, as opposed to fish oil. But, you know, they'll be the ones that are belching away on the fish oil and then they're miserable. And so you say, okay, take the chia seed, and
Right.
then they're happy.
Right.
So, you know, other things like zinc or copper or chromium or selenium, you know, some of all of those things is valuable. The big ticket ones that push people's metabolism back and forth on that continuum would be magnesium and potassium, which the vegetarians need, and calcium, which the parasympathetics need.
Right.
So those are the big ticket minerals, so to speak, in terms of autonomic balance.
Okay, well, I would love to have you on again another time, but I want to respect your time, and we're coming up here. So I got a question for you before we wrap up. There is the I have never read in alternative. I don't know if you call it alternative, but let's call it natural medicine. Natural medicine. I've never read so many case studies, documented case studies of the results that you and Dr. Gonzalez has had.
Mhm.
Why? This is a huge question for me. Why is it that all of the people I talk to, no one has heard about it? Like, well, I shouldn't say no one, but why is this not more practiced by more medical doctors or even naturopaths with high dose enzymes, personalized diet, detox? Why aren't people doing this? There's thousands of case studies to prove that there's something here. What's going on with that? What do you think is happening? Why is this not the number one talked about thing?
All I can say is you'll have to ask them. I don't know. I don't know the answer to that.
I have a theory. My theory is that, and I gotta say it is and this is why I like talking to you. My theory is there's not a lot of money in it. I think a lot of times, like what we're talking about is a personalized diet, high dose enzymes, and detox. And I'm thinking, if you were the kind of doctor that wanted to make money, you should be talking about a specific technology that no one gets access to, and they have to come to you in order to. I mean, so do you think that money has a role to play in why this isn't the most popular talked about thing? Do you think that has anything to do with it?
Probably,
Yeah.
but but you know, I guess all I can say, you know, I try not to go down that road in my own thinking because it doesn't motivate me to do what I can to change it.
Right.
But that's correct. I mean, and it's been rather maddening over the years. We've had people come to us and they'll say, "Well, I already spent all my money doing all these other things, and I came to you last because you're the cheapest." and meanwhile, we're kind of scratching our head because the patient at this point is too sick and they're not going to be able to do well on the treatment.
Right.
And I don't know. I mean, I, I don't know what to say on
Well,
that one.
well, let me just say thank you. Thank you so much that you're willing, as a medical doctor, that could be, I know you could do all kinds of things because you have your license, you're a medical doctor, but thank you for staying true to what you believe in your heart is truth. I think that there needs to be more people that stand for truth and what they believe in their heart is true. I'm not saying that you're infallible or that you can't maybe, but I can see that you and Dr. Gonzalez truly believe this is true. There's a lot of truth to what you're doing. I think we live in a world where we need more people that stand for truth. So thank you for doing what you're doing and making sure that people are aware of what you and Dr. Gonzalez have really kept alive from Dr. Kelly and Dr. Beard throughout that time. So, and really thank you for coming on and sharing this with people. And I'm sure it's just whetting people's appetite so they can go to your website. I'll make sure that that link is there. They can subscribe to your newsletter. There's lots of other books they can read. I've mentioned a bunch of them. So hopefully people just dig into it and really see that there's a lot of truth here.
Well, thank you so much for your support. I appreciate it. And I've enjoyed talking to you today. It's nice to meet another enzyme enthusiast.
Awesome. Thanks, Dr. Isaacs.